Bismillah ar-Rahman ar-Rahim. Our case today is very interesting. History: 45 days old boy presented to the clinic with right forearm skin discoloration and swelling, seemed to be skin and soft tissue infection. This baby in ICU graduated due to what? Late preterm, 36 weeks, and resolved RDS and resolved neonatal alloimmune thrombocytopenia. This is history. What about clinical assessment, clinical evaluation, examination? On examination, local examination and systemic examination. Local examination, right forearm area and cubital fossa. There is sign of infection and inflammation. What is this sign of infection and inflammation? 5. Hotness, redness, swelling, tenderness, and loss of function. There is pus formation with hole depth 0.2 centimeter, and around this hole there is erythema and skin discoloration about 1.5 centimeter. What about the perfusion, pulsation, assessment of the limb? The limb is warm, no pallor, and peripheral and central pulsation within normal and preserved. So it seems to be skin and soft tissue infection, but still we would like to know if there is invasion to the muscle and the bone. I have to assess by X-ray, looking for if there is evidence of osteomyelitis, and ultrasound Doppler to rule out if any invasions to the or thrombosis, or to rule out acute compartment syndrome. So what is your assessment and evaluation? Our assessment and evaluation from the history and the clinical examination. This is skin and soft tissue infection. I have to classify this is purulent or non-purulent, because if purulent, this is abscess or furuncle or carbuncle. If non-purulent, it will be what is called cellulitis or Erysipealas or necrotizing fasciitis. So I have to treat this patient. What is the treatment? Depend on what? Depend on the general condition of the baby. If the general condition of the baby is toxic or unstable, so I have to take septic up and started antibiotic. And if there is suspicion of any bone invasion, I have to do X-ray to rule out osteomyelitis. And if there is any suspicion of thrombus, I have to do Doppler ultrasound. Then if there is purulent skin and soft tissue infection, depend on mild, moderate, and severe. Mild, you have to do incision and drainage. Moderate, you have to take culture and sensitivity and start BO or IV medication. It will be first generation cephalosporin or oxacillin. If severe, so you have to take culture and sensitivity and start IV antibiotic. IV antibiotic depend on the organism. As we know, strep for cellulitis or diffuse infection, and staph for localized infection. So staph community acquire methicillin sensitive staph aureus, I have to start first generation cephalosporin or oxacillin. If this is community acquire methicillin resistant staph aureus, I have to start vancomycin or linezolid. Our reference, it's come from Oxford clinical infectious disease. So put in your mind, if there is severe infection, you have to take culture and sensitivity, and you depend on the community acquired staph resistance or sensitive. Staph resistance, vancomycin and linezolid. Sensitive, oxacillin and first generation cephalosporin. ومن أحيا فكأنما أحيا الناس جميعا. شكرا، سلام عليكم.